Hi everyone, it's 11 o'clock. There's a couple of people joined us. I might give just give us one more minute. I see Sarah's just joined us as well. If I could ask everyone who is on the call, if you wouldn't mind just changing your names so that we've got your institution as well as your full name, so we know who's on the call, just in case you've got any questions and we know where you're dialing in from. Okay. Hi everyone, I am Claire. I work as the events officer here at the EAUC. I'm going to be hosting today's webinar. Just a little bit of housekeeping. Obviously, as you come into the call, all your microphones are on mute. If you could just leave those on mute just so that we can minimize any background noise. I might be guilty of that myself. My computer is very noisy. If you could, as I asked, just change your names on Zoom so we know what institution you're on. If you can just click on your name in the delegates, it should give you the option to rename yourself, so you can just change your name on that. We are recording this session, so we will make it available on the Sustainability Exchange for any of your colleagues who might like to hear what's happening. And also, just so you know, at the end of the session, we will be doing a very, very quick Slido poll. So if you can open up your browsers, type in sli.do. The hashtag for this one is healthy minds, all one word. I'll put it up towards the end, but if you could have that open, very short feedback just on this session, and then on any other topics, use your imagination, whatever you like, that you would like to be hearing about, that the EAUC can support. It would be really great to just hear what's on your mind and what you would like to hear more about. So we're running this webinar today really to link in with World Mental Health Day on the 10th of October. We're hearing from two winners, recipients for the Office of Student Challenge competition, which was encouraging universities and colleges to work with key partners to improve mental health outcomes for students. So we've got two of those projects on the call today. We've got Cara Holloway from Keele University's Student Mental Health Project Coordinator, and she's going to be talking about Start to Success that Keele are running, and that runs as a number of projects that Keele are using across the university. After Cara, we'll hear from Jamie Darwin. He's the EDI projects lead at UWE. He'll be talking about the Student Mental Health Partnerships project at UWE. So we're going to hear more about that from him in a minute. But first, I'm going to hand over to Cara for the Start to Success. And if Cara, you'd like to share your slides, that'd be great. And you'll need to unmute yourself.
That's a classic one, isn't it? Not unmuting yourself and starting to talk. Thank you, Claire. Yes, can everyone see the slides all right? Yeah, okay, thank you. So I'm Cara Holloway, I'm from Keele University. And as Claire mentioned, we were one of the recipients of the OFS funded Challenge Competition Fund. And our project is called Start to Success. I'm just going to give you a bit of an overview about the project today. Given the time, I'm not going to be able to go into too much detail, but I will put my email address at the end. So if anyone's got any questions, please do feel free to get in touch afterwards. So I don't need to go into any detail on this. Claire just kind of outlined that the OFS launched a challenge competition to find innovative ways to combat the sharp rise in increasing student mental health issues. So 48 institutions submitted bids for the challenge competition, and 10 were successful in receiving funding. And Keele University was one of those 10. So we were lucky enough to receive £750,000 from the Office for Students. And our project is a 2-year project which aims to develop a whole community approach to support the mental health and well-being of students. So a lot of regional partners have been involved in the project, and we've all come together with a common purpose to remove barriers, improve support and services, and enable student success as well. So as I mentioned, this is a whole community approach, and we have got 16 project partners. Our main project partner is Staffordshire University, which is the closest university to us locality-wise, and also the student unions associated with both universities. We've linked up with the 2 local councils. We've got 3 local FE partners as well. 4 NHS trusts are involved in the project, as well as the local police, and also SASOT, which stands for Sport Across Staffordshire and Stoke-on-Trent as well. So our project has 3 key priority areas, and these are student transitions, early intervention, and step change in support. And what I'm going to do is go through each of these 3 in a little bit more detail and talk about some of the work that we have done towards these areas, as well as the other strands of the project as well. So student transitions, we want to sort of improve the transition into, through, and out of university for students, especially those who may be vulnerable to mental ill health. As part of the project, we've recruited a number of project officers who each have an individual work stream within each of one of the 3 themes. So what I'll do is I'll just kind of give you a quick overview of what work streams are within each theme, and what work we've done to contribute towards that as well. So one of our very first work streams is working with our FE partners, so supporting the transition from college and 6th form into university. So one of the things that we've been doing in this area is developing and delivering a series of wellbeing workshops to FE students. So this will include information about how to keep well whilst at university, and also what support is available when the student does arrive at university. We're also looking at a piece of work as well around disclosures of mental health issues and encouraging students who may have mental health challenges to report this in their UCAS form when they're applying to university, so that the universities can pick this up and offer them the support that's needed. We're also looking at that transition from child services to adult services as well, and the potential disconnect that there could be there for a lot of students. And finally as well, our FE liaison officer has created a fantastic transition handbook to support students from that move from FE to HE. This isn't Keele specific, so if anyone would like this to share with any local colleges in that area, I'm more than happy to do that. So we also have some specific support for our foundation year students and postgraduate students. So with our foundation year students, we're supporting them with the transition from foundation year to the first year of their undergraduate degree. What sorts of things do they need to be aware of? How might it be different? And we also developed a peer mentor scheme for foundation year students. We find a lot of our foundation year students withdraw from the university and don't progress to the first year of their undergraduate degree. So we're trying to develop a buddy system, a peer mentor system, where someone who has completed the foundation year degree and has now begun their first year of the undergraduate course can support those that are just starting in their foundation year journey. When it comes to support for our postgraduate students, we've developed a great resource for PhD students to support them with working during the pandemic. So support on how to work remotely and working with their supervisor remotely, and things like that. We've also established a fortnightly postgraduate wellbeing session, which is being led by Mind. So students can come along to the session and discuss any challenges they might be experiencing and get some support there. We've also created an online community for all new PhD students so that they can virtually meet each other, in recognition that a lot of students can't meet each other in the current climate. So we wanted to create some sort of online community for them. And then finally, within this transitions theme, we're also developing a programme of staff training. So we have actually booked 9 half-day training sessions across the semester for staff from Keele and Staffordshire University. And this is around mental health awareness, supporting students, so knowing how to have a conversation with a student who might disclose a mental health condition, knowing how to make appropriate referrals, and knowing what support is available at the university so you can signpost students that way. We've actually had all sessions are fully booked within the space of about a week, which shows the demand for this sort of information. So we find that really positive. So by the end of this semester, we'll have trained just under 150 staff members on this. At Keele, we've also delivered a parallel session looking at how staff can look after their own wellbeing, and also support colleagues who may be struggling. So this will include the ways to wellbeing, with a specific section on working remotely and how this can impact wellbeing, signs to look out for, and how to get support. So The second theme of the project is early intervention, and the idea here really is to develop and implement interventions that will support student mental health and well-being. So one of the work streams within this theme is coaching and lifestyle coaching. So what we've done is developed a handbook for personal tutors based on coaching methods, and the idea is that personal tutors will look at their personal tutoring style, how this will impact the support they can offer to students, and also teach them skills on how to have conversations with students about their well-being. So this handbook will be supported with some training that will be delivered to personal tutors. And we've also got some, the project officer working on this strand has also got an interest in tech and VR EEG headsets and how we can use these to teach students to concentrate and focus the mind using virtual gaming. So we're hoping these skills they can gain in order to focus and use this in their everyday lives. We also have active wellbeing as one of the key strands. Obviously, one of the ways to wellbeing is to be active. So we're trying to make our active sessions as accessible to students as possible. We've had a bit of a focus on international students so far, but our active wellbeing officer has also been doing some work across campus, encouraging staff and students to be more active, to reduce sedentary behaviour, and to try and just kind of use the campus to the best of its ability. Our active wellbeing officer has actually also developed a module for students about how to keep well at university. So this obviously includes information about being active, but also about diet, sleep habits and alcohol use and how this can affect well-being. And she's also developed a behaviour change workbook for students to make lifestyle changes based on goal setting and smart action plans. So it's all about kind of changing those behaviours just by making it as achievable as possible and breaking it down into smaller goals. One of the key strands is support for students who might be withdrawing or looking to take a break in studies. So what we've done is piloted several initiatives to support students who are going through this process. So we've implemented some clearer guidance for staff and students about exactly what this process entails. We're developing a personalised plan for students for when they return from a break of studies. We're creating a little welcome backpack for students when they do return, which will include a little personalised postcard, which will outline what support's available, but will also include some social activities for returning students, recognising that a lot of their peers may have progressed to another year and might not be in the same course anymore. So things like coffee mornings or virtual coffee mornings as it might be at the moment, to try and build a sense of community there again, and also some welcome back reinduction meetings with staff as well. At Keele, we're developing a student engagement monitoring dashboard. So here we're going to be highlighting to students and to staff when a student might stop engaging with the university. And the idea here is we can intervene much earlier, it'll flag much earlier to staff when a student stops engaging, so we can get that support in there much earlier. This will be based on a range of data from across the university, including things like attendance, Wi-Fi usage, library usage, engagement with support services and things like that. It's still very early days for this project, so I don't have much more information at the moment, but we're going to be piloting this within the first semester, so I'm happy to take any questions once we've piloted this. And we've also over at Staffordshire University integrated Together All, which was Big White Wall, into their chatbot system. So if any student makes an inquiry, which is wellbeing or mental health related, they're immediately signposted to Together All to receive immediate support from there until a welfare advisor responds. And we've done a lot of work to sort of improve the signposting and self-help resources that are available to students as well. The final theme of the project is step change in support. So the main areas here is looking at approaches to needs assessment and referral pathways. So again, we have a project officer working specifically with our NHS partners. And the idea here is to improve referral pathways and discharge protocols, as well as improving communication between organisations. So she has actually established a data sharing agreement between our local NHS trust and the university to be able to support this work. And quite exciting initiative as well. As part of this role, we've recruited several NHS student champions from all different teams within the NHS trust, whose role it is really to be that direct line of communication between the NHS and the university. And these NHS student champions, the idea is that they will have a really thorough understanding of what specific struggles and challenges students might face, and how that can impact their lives and what things we need to be considering when we're supporting students. So obviously students are really transient. We need to think about where they're living at the time and what support is available at the university that they might already be receiving and things like that. So we're also going to be logging student access, student use of services onto a dashboard as well, so we can see what the pathways look like and where any gaps and barriers might be as well. At both universities, we do also have out-of-hours support officers now. So any students that might need any support out of hours through the night, we do have staff that are available as part of this project. So they are based within the student services team, but they operate alongside campus security when they're on shift. And finally, both universities are members of the local suicide prevention partnership and are working with the local council on a suicide prevention campaign. And also in 2 weeks' time, Keels has invited Silence of Suicide, the organisation, to come and deliver a virtual session for students on campus as well. So as I mentioned, it is an absolutely massive project, and there are quite a few other work streams that are happening at the moment. One of the key ones obviously is data collection. So we run an annual survey which captures student wellbeing data and also helps us to assess project impact. We also conducted some more focused research during lockdown to pulse check student wellbeing during that time, and to ask them, what can the university be doing to support you more? More than happy to share any of the reports that came out of that with anyone as well. We also have a student advisory panel. So approximately 20 students from both universities sit on a voluntary panel, and they provide guidance, suggestions and feedback on all of the aspects of the project. And just to note as well, our student advisory panel are all students that have a lived experience of mental health issues. And finally, our wellbeing ambassadors. So we've just recruited 3 paid ambassadors at both universities, and their role is to develop weekly wellbeing activities for students. Fairly light touch activities, things like cookery demonstrations, mindfulness and games nights and things like that. And just my final strand of the project, oh, there we go, is about our campaign. So we, as part of the project, we're developing a regional mental health campaign. This has been developed in conjunction with students. So we ran a series of student workshops and focus groups, and they essentially came up with 3 themes that they felt would be really, really important for a regional mental health campaign to cover. So the first is isolation, and the key messages there are really encouraging students to make connections with others, obviously recognising that at the moment students might be physically isolating due to the pandemic, but might also be feeling really isolated due to the start of term and everything else that comes along with that. So we want to encourage students to connect with others, show different ways they can connect, particularly highlighting things like societies and clubs for students to get involved with and meet like-minded people. There's also another element to this theme in thinking about who isn't there. So this is based on supporting a peer who might also be struggling as well, and how best to go around that. The second theme is reducing stigma. So this is to encourage students to talk openly about mental health. We want to improve the education around mental health, including busting myths and things like that, and also encouraging students to take action, so to get involved in campaigns and be a part of the movement around this as well. And the final theme is self-help. So this will include things like the ways to well-being and how to look after yourself, but it will also help students to recognise when they might be struggling with a mental health issue, and to also let them know what support is available if they feel like they need it. There were a couple of other things that the students recommended we covered when we talk about mental health, one of which is alcohol and drug use, and the other is financial support and financial well-being. At both universities, there were already really established campaigns around these 2 areas, so we've committed to integrating mental health into there, but it was just also important to think that those were 2 other key areas that students felt were really important to talk about when we're discussing mental health. So that's it from me. Thank you very much for listening. I think Claire's going to send around the slides afterwards, so my email address is here, or you can drop me an email just by looking on our website. There is loads more information on the website, including regular updates, and we also have a monthly newsletter, so if anyone's interested to hear about what the project gets up to on a monthly basis, please do let me know and I can add you to the mailing list. Thank you.
Great, thank you so much, Cara. That's really helpful and a lot going on. So really good to hear about all those projects. And I'm sure that we'll have a few questions towards the end. I'm going to start Jamie off now so that we can hear about him. And then once he's told us about the projects that EAUC are doing, it'd be great to just get some questions. So we'll get on to Q&A, but for now, I'm going to just hand you straight over to Jamie. So I'll stop sharing my screen, Jamie. Jamie, are you there? Sorry, you're still muted.
Sorry, I hadn't started talking yet, but yeah, I'm
Okay.
so I'm just trying to get my presentation up.
Excellent. Yeah.
There we go.
Perfect.
Right. Yeah. Thank you. Hello, everyone. Yeah. Thanks very much, Cara, for your very interesting presentation. So I'm going to talk now about our project at EAUC. My role at EAUC, I'm a projects lead in our Equality, Diversity and Inclusivity team, which essentially means I have responsibility for a number of projects in that area. Our definition of EDI is quite broad, and it includes quite a lot of work around student mental health as well. So our project is less concerned with general well-being and preventative measures, if you like. It's more concerned with relationships with local NHS services and therefore with students who are in need of care or clinical treatment that would need to be provided by NHS services, going beyond what could be reasonably expected from a university service. And our project, as I won't go through the detail of this slide, but this is really just to illustrate that there are a large number of partners involved in this project, and in fact it's working in a number of regions around the country, not just in Bristol. But I'll come on to explain all of that. Yeah, Cara talked about the mental health challenge competition that was run by the Office for Students and the funding available through that. We were successful at being one of the 10 projects that were awarded funding. So our project is being led by EAUC, but is involving 5 regions around the country about developing closer partnerships between university mental health services and NHS services in those regions. So what's the need for this? Why are we doing this? Students in higher education experience a huge variation in their mental health care. And in particular, our project has been guided by a report published in 2018 by Universities UK called Minding Our Future. And if you're not familiar with this report, then I'd say it's well worth a read. One of the main findings of that report was an urgent need to better coordinate support and services between universities and local NHS. And so some particular issues or factors that the report found were difficulties in coordinating care between NHS primary and specialist services, and that's provided by universities. Often students are falling between the gaps between those services because there's not a clear understanding of where does the university commitment to provide support end and where should the NHS provision start. And often NHS services are making a lot of assumptions about the support that is provided by universities. They make assumptions that students are all living together in halls of residence that are well supported by the university, and that a lot of issues can be picked up there, or that universities have mental health and counselling services, and therefore there isn't a need for NHS care unless it gets to sort of very extreme crisis level. So there's a lot of lack of understanding of what universities are able to provide, and indeed what universities, what our responsibility really is. Also issues around the mobility of students. students move around the country a lot. Clearly, a lot of students will move between different regions of the country, between home and university, and information about their condition, any treatment they're receiving, rarely travels with them. So a lot of students might arrive at university. They might mental health services can look very different in one part of the country to another. So they might expect to find something that looks like the support they have back home, and they're not able to find it so easily. And it can be quite difficult for universities and the local services to pick up information about that because of issues around data sharing. So say, yeah, those issues of data protection and consent make information sharing very difficult. Cara described in her presentation the information sharing agreement that they've established with their local NHS services, but those kind of data sharing agreements are not usual around the sector, so it can be very difficult to share that information. And students might be seeing GPs at home or in their university town, and again that information is not being shared routinely. And finally, the report identifies specialist needs that many students will arrive at university with pre-existing conditions, might be sort of eating disorders or self-harm and things like that, and those kind of conditions require then effective coordination of care to be picked up, and often some adjustments needing to be made for their study or their experience at university that universities might not be aware of when they arrive. So those are the needs that we identified, and then yeah, a lot of very I won't read out all these, but a lot of very powerful statements coming from students themselves about their experience of accessing care. And I think a common theme across these is a feeling that they end up having to repeat their story many times to different care providers and different services, and that can be quite exhausting. They might have assumptions about joined up services and the fact that all these things, or this information will be shared, and they shouldn't have to do that, but the reality is very different. So they experience very disjointed care, and it's very difficult to navigate their way through all the services in front of them. It's very hard to find sort of a clear pathway that explains that this is the entry point, and I might go here and I might go here, and this is the care I might expect from each of those parts of the system. So our project then is set up to try and address some of those issues, and in particular to try and improve the care for students that are in need of mental health support through establishing new local pathways between universities, local NHS services and student unions, and then to evaluate what we've established through those partnerships to then make recommendations about yeah, what do good local pathways look like? What does good practice look like in terms of how care pathways are being designed and delivered? And can we then share what we're learning about these models for the wider sector? So our project is then, as you can see, it's very much more structural and strategic in nature rather than delivering particular services, but it's trying to learn about how services can work together more effectively, and how we can then evaluate the care that is being provided, and produce some recommendations of good practice and toolkits around how those care pathways and the evaluation of that care can then be delivered. So the 5 regional hubs that we are setting up are in Bristol, where I'm based, but then also in Liverpool, Greater Manchester, Sheffield and North London. And I'll talk a bit about what each of those regional hubs are doing. They're all distinct. One of the important elements of the project is recognizing that every region is different. They've all got their own local contexts around what the university population looks like in those regions, what the NHS services look like in those regions, and all those and how things are funded, and all those things look slightly different, and so there are different priorities in each of those regions. So I'll talk a bit about what the project looks like in each of those areas, and then how we are stitching that together as a national initiative. So look at how what the project looks like as a whole. We've got our 5 regional hubs. There's an important element of student co-production in each of these. So in what we're doing in each of those 5 areas is informed by student need and by the lived experience of students themselves. And we're being assisted in that by a national organisation called Student Minds that has done a lot of work nationally, working with a lot of universities and producing guidance on how students can be involved in co-production of mental health services. All those 5 hubs are then feeding into a national learning collaborative that's being led by Universities UK. So that's bringing together all the partners involved to learn about the partnership models and the models and structures and systems that we're developing, and how that can then be used to inform policy with regard to the work the Universities UK is doing around national policy in this area, but also feeding into the NHS long-term plan. So we have the commitment through the work that Universities UK does nationally with the NHS to inform the NHS long-term plan and how that's working with higher education students. And then there's an important strand of work there that we call our Pathways and Outcomes Evaluation that is being led by colleagues in Sheffield and UCL in London, that is developing a model for how we evaluate the care pathways that are being developed through the project. And that will produce a model and a toolkit for that evaluation. I'll talk a little bit more about that in a minute. So what are each of the 5 hubs doing? As I say, they all look slightly different. In Bristol, the project is not so much developing a new service, but trying to bring together the existing services in a more strategic way. So we've developed new connections between the 2 universities in Bristol and primary and secondary mental health services in Bristol, and in particular through setting up a body that we call our Practice Liaison Forum, which is bringing together professionals and practitioners from all those services on a regular basis to share information about how those services work, to share understanding, particularly understanding of how risk is understood and managed, and essentially just try to get much more embedded regular communication between professionals working in those services. Some of the issues that I outlined before about just the lack of understanding of what university mental health services are providing, and we're finding already with that body being established for just under a year now, there's already much better understanding, which leads to much better referral processes from the university services into NHS. Previously, we're finding it tended to be very much about who you know. So a professional working in the NHS, if they happen to know the referring, the person making the referral from a university, if they happen to know that person, then they'd be more willing to take on a referral. If they didn't know that person, there tend to be a lack of trust and a feeling, oh well, this is a problem for the university to deal with. We don't need to take on that problem. So already we're finding that those referral processes are a lot more better informed and happening much more easily. And the task now is to make sure that's embedded properly within the structures of what we're doing. So the main priorities are around information sharing, around developing those clearer pathways for care, around establishing a better common language between professionals about how they're talking about risk and understanding risk and referrals. Trying to get better research, better understanding of how students are experiencing care pathways and where the barriers are and where the gaps are that they're experiencing, and bringing the student experience more fully into that process. So similar to the way Cara talked about recruiting student champions who can provide a bit more of that bridge between the student experience and what those services are providing. And we also have the commitment from each of our local NHS services, such as each of the crisis team and the early intervention team and the triage team. They've all identified now a student lead for those services who will take a designated responsibility to be proactive about that engagement with the universities. In Sheffield, what they're establishing in Sheffield is effectively a new service. So this is bringing university and NHS much more closely together in an integrated service. They're establishing a new university-run clinic, which brings together clinical academic staff employed by the university, essentially research staff that also have a clinical role, and NHS-funded trainee clinical psychologists. And this creates a win-win model for both the university and the NHS in that it increases capacity through using trainees in this way. It's bringing more capacity into the system that enables students more easily to access treatment, and therefore also takes pressure off the university mental health services. And at the same time, it's also providing these clinical trainees with a high quality placement experience, and it's giving them a more direct practical experience as part of their training. And also by providing the primary and secondary care within the same clinic, it's helping to bridge that gap between primary and secondary care. So the Sheffield project has launched that service now, and it's also looking at how then they evaluate the care that's being set up as part of that service. The North London Hub, which involves UCL and Imperial College in London, is similar to the Sheffield project in that it's setting up a university-run clinic with trainee clinical psychologists in a similar way, and it's also developing it's got a strong student engagement theme that's developing a lot of peer research and peer support work, using students who are conducting research projects and workshops and focus groups with students who are accessing these services. In Liverpool, the focus of the project is more specifically on students who self-harm, and Liverpool have been developing a partnership between Liverpool University and Liverpool John Moores with their local Merseycare Mental Health Trust, and developing a new service embedded within the universities that they're calling EAUC for students who self-harm. And that had been that service has just launched this September, and the aim there is to tackle a specific issue in Liverpool where too many students were presenting at accident and emergency with self-harm and was in danger of overwhelming that service. So the aim of the project is to try and pick up those that need for intervention at an early stage, and then preventing so many of those students presenting to A&E services. And then through that service, they're then aiming to develop and evaluate a single assessment framework for self-harm, and developing a new care pathway and training for referrers to understand how they can use that service. Then finally, the project in Manchester is part of the devolution settlement in Manchester, in Greater Manchester, that has devolved healthcare to the Greater Manchester region, and then new structures are being set up as part of that devolution. And as part of that arrangement, Greater Manchester launched a new integrated student mental health service in September of last year, which is a partnership between all the HEIs in Greater Manchester and the devolved NHS services in the region, to create a single designated mental health care pathway for students at all the universities in Greater Manchester. So our project hasn't been to set up that service in itself. That is a much bigger project. What our project is doing is carrying out an evaluation of that service so that we can learn lessons for how that partnership has been put together, and the single care pathway that's being set up as part of that, to see can we then apply the lessons from that to other regions of the country. So that evaluation is being co-produced with students and service users and professionals in those services, and we'll understand the impact of that new service and the models that have come out from that. So those are the 5 regional hubs, and then the final thing I'll just talk about is the pathways and outcomes evaluation work that stitches all that together. So we have an evaluation team that's being led by UCL and Sheffield, and that has been working with partners in all our 5 regions to map and analyse the services that have been developed and the referral processes, and that by the end of the project will be producing an evaluation framework and toolkit for care pathways between universities and NHS services. And that toolkit, they've carried out a baseline research with all the partnerships already, and then they'll be working with the partnerships over the next year to build up a toolkit which will include principles around partnership working, around things like clinical governance, how these partnerships are established, and the governance and the structures behind those. Very important work around the management of risk, and what I've talked about already, about how we have common understandings about how we talk about risk, and how we understand what levels of risk are appropriate to be met by university services, and where the NHS needs to be involved, and then the developing metrics around how we routinely monitor and measure outcomes for students who've accessed these services, and how we're able to share data across services, which can be quite a difficult process to get those agreements established and data being shared effectively between all these different services. So by the end of the project, in around about a year's time, we will have a number of publications from the project that hopefully will then be useful to the rest of the sector on how they can establish similar partnerships in their own regions. So to finish up, so again, very happy for these slides to be shared, and you can find more information from our project website, from a case study that was published by the OFS about how the project has helped support the response to the pandemic, and the findings that we had, that the partnerships that we'd established in all these regions were being very useful at sharing information about how mental health services across universities in the NHS have been impacted by the pandemic, and we're able to share intelligence about what these services are expecting to come down the line in terms of sort of future demand for mental health services. And yeah, finally, very, very happy if people want to contact me for more information about any of this work.
Great, thank you very much, Jamie, for a very comprehensive list of projects and lots of different things happening in different regions. So that's really useful. Obviously, everybody's situation is slightly different, but I think there's kind of a lot of overlap in terms of what you're doing, and lots of great collaborations there. We've got some time for some Q&A. If anyone has got any questions, either just pop your questions into the chat box, or if you are happy to ask your question verbally, just pop your hand up and we can unmute you, and yeah, you can ask your question verbally. Anyone want to kick us off? Just a quick one from me. I know you both talked about student inputs in terms of, getting your information together and what students are looking for. Jamie, I know you mentioned student minds. Are there other ways that you kind of collated information from students in terms of what they wanted to see and what they thought was important?
Yeah, so we've had kind of student input at a number of different levels in the project. I think first there's kind of the more strategic governance level, if you like. So that's been through engagement with student unions and student union officers, typically sabbatical officers who come to our National Learning Collaborative and sit on steering groups at each of the 5 regional hubs. So they're engaged in that sort of design and delivery at a strategic level, but then also engaging students who've had lived experience, who've been through, who have accessed care through NHS services. And what Student Minds have helped us with is sort of with the tools. Student Minds have developed a really good co-production toolkit. And if any of you have not seen that, I think it's well worth a look, because it gives you a lot of tools and models that you can use to kind of design these interventions, whether it might be surveys or focus groups, or other ways you can engage students in learning about their experience and get them involved in the design of what you're doing. So we've been engaging students who've got lived experience, using some of those tools to engage them in different ways.
You put a link perhaps to that toolkit that we could just share with everyone.
Yeah, sure, if I can find it quickly.
Or you can send it to me afterwards.
Yeah, I'll have a quick look now. If I can't find it in a couple of minutes.
Cara, did you have anything to add to that?
No, we've done something very similar. So we have developed a student engagement plan, which is based on the co-production guide that Jamie's just mentioned. So it covers student engagement from everything from just consulting with students through to co-production with students. And we've used that to kind of create an engagement plan of how we would link up with students. I mean, I'll be honest, it's been a little bit more difficult given the current situation at the moment. We have found that students are just being bombarded with information about COVID-19, and they've had less capacity to engage in this sort of activity. But linking up with the sabbatical officers has been really helpful for us, and obviously the development of our student advisory panel, our wellbeing ambassadors. We have a few student societies that are focused on mental health as well that have been integral. So I kind of echo what Jamie said, really.
Okay, I've got a couple of questions coming through, and thank you, Jamie, that you just sent through that link. So this is a question from Claire Alcock from Wakefield College. Cara, how are you delivering the wellbeing workshops in the current pandemic? Are they virtual events, and are you happy to share the content?
Yeah, absolutely. So they are virtual events at the moment. Everything we're doing is virtual in terms of wellbeing activities like that. So at the moment, we're using Microsoft Teams quite a lot to share information with students. At the start of the year, students were sort of pre-put into different teams, and one of those was a wellbeing channel where all our wellbeing activity was filtered through there. We have got some resources already on the website, so feel free to have a look at those, including one of the most recent wellbeing workshops that we did. But if there's anything else you need, just drop me an email and I'm happy to share anything else with you.
Okay, great. A couple of questions coming through. Daniela Riccardi from Cardiff has said, thank you, Jamie. How portable are these initiatives on a broader scale beyond the 5 universities, I think the 5 hubs yet?
I guess we won't really know that until the end, until we start sharing it. But our hope is that because we're doing this work across 5 regions that are all very different, we'll be able to draw lessons from that will be more generally applicable, and there'll certainly be models around evaluation and information and data sharing that should be fairly common. I see that you're at Cardiff, so actually we're already working with a number of regions outside the 5 that are part of our project, and Universities UK has been quite keen as a UK-based organisation to look at how we can link outside of England as well, and actually Cardiff are involved already in our National Learning Collaborative. And so although they're not part of the project, we're already looking at how the lessons from our project can be can be taken on by in Cardiff, Edinburgh and Belfast. And Cardiff has received funding itself from the Welsh Funding Council to do a very similar project to us. So we've had quite a lot of dialogue between our Bristol hub and Cardiff to share learning between what we're doing, because they're setting up a very similar model. If you want to know, I can't remember the name of the people in Cardiff who've been talking off the top of my head, but if you want to contact Cardiff, then please contact me outside of this and I can put you in touch.
Okay, great. And speaking of Edinburgh, Vanessa, would you like to unmute yourself and ask your question?
Hi, thanks, Claire. Yeah, thanks to both of you for the talk. It definitely made me realise I should be doing a lot more in an overt way. My question is, well, a bit of context. I work in the Department for Social Responsibility and Sustainability, so we're sort of out with the core student support services. But we do work with students. So my question was to either one of you is, do you think as somebody working with students, but in a sort of in the corporate support side of the university, should we continue with sort of signposting to these types of services as those services are perhaps more professional than the knowledge that we have? Or I suppose the question is, yeah, should we continue with signposting, or is there something that you think that we should be putting together when we work with students to kind of, you know, our first meetings with students? Should we be offering support ourselves, or just sticking with the signposting to professionals? Thanks.
I can say something on that. So I'd say, firstly, that would depend quite a lot on your own institutional context. And exactly what support services you have in place and the way they've been designed. I would say what I would recommend all universities should be looking at is the step change framework that has been that was developed a year or two ago by Universities UK and Student Minds. I can probably find a link to that as well if that'd be helpful. And that talks about a whole institution approach to student mental health. And so I think the idea being that, yes, the support services can pick up particular issues, but actually a lot of this needs to be embedded in many different places across the university in order to do some of that more preventative work and that more general wellbeing work to try and avoid many students accessing the support services. We need to try and stop it before it gets to that level. So yeah, I'd just have a look at that step change framework and look at what you can do as a whole institution approach around supporting mental health. We found when we carried out some kind of audit of what was going on in terms of supporting mental health around our institution before we bid for this project, we found about something like 40 or 50 projects or interventions going on across the university that were supporting student mental health. And the trick is to try and connect those together better.
Cara, anything to add there?
No, I completely agree with that. To be fair, we've kind of got the two-pronged approach where we will provide staff with the kind of skills to have a conversation with students about their mental well-being. But the main thing really for us is that staff are aware of what support is available. So it's not their responsibility to take on that themselves, you know, it's just knowing what support is available. But we also do a lot of self-care things as well. So promoting to students how they can look after themselves to try and do kind of promote that early intervention sort of strand as well.
Great. Just a couple more things just from Claire Alcock. She's from a college, so obviously a slightly different situation. She's interested in the wellbeing ambassadors and what their role is. Yeah,
so our wellbeing ambassadors, so at Keele, and I think most universities, we already have a team of established student ambassadors who support with all sorts of university duties, you know, open days and things like that. And what we've done is recruited three of these ambassadors to become specialist wellbeing ambassadors. We've essentially trained them to know sort of what the specific challenges are around student mental health, what support's available, how students can look after themselves. So the idea is these ambassadors are running weekly activities for students. They'll organise, deliver, evaluate within their little wellbeing ambassador team, but then they're also sort of peer support in regards to being able to signpost students to what help is available. So we find students are most likely to go to other students They feel much more comfortable talking to other students about mental health and things like that. So that's why we've trained these students to be able to support with that.
Great. And then just a quick one, I think also aimed at Jamie from Claire again. Would the step change framework be useful as a guide for further education institutions? Because she's saying she's a college, not a uni.
I would think so, yeah, because it's essentially about just taking a whole institution approach, and yeah, I think that would apply. I mean, there might be elements of it that would apply particularly to the situation in the university, but essentially it's talking about culture change, system change that would be appropriate in any institution. So yeah, I would have a look at it.
Okay, great. And then one from Val Morgan from Cardiff. A question for Cara. How easy was it to set up the data sharing agreement, and were there any major obstacles in doing that?
There absolutely were major obstacles. It was quite a tricky process, I'll be honest with you. It took a long time. I wasn't as closely involved in that strand, but what I can do is, if you just want to pop me your email address, I can link you up with the project officer that I'd lead on that if you wanted to ask her any questions. Like I say, I wasn't as closely involved, but I'm happy to link you up, and yeah, she can share learnings.
I think let Val have your email address, Cara, and then she can get in touch directly. James?
Yeah, I was just going to say, yeah, I'd echo that and say, so I mean, we're in the process of doing that in Bristol, and we haven't got there yet. So I'm impressed that Keir have managed it. There are obstacles, but the other thing I think is worth saying is even when you've got there, there are still difficulties, because, for example, NHS systems don't routinely record that somebody is a student.
Yeah.
And what university they're from. So even if you're able to share them, one of the difficulties we're having in Bristol is that, for example, at Bristol University, they've got a GP service in the university that most of their students will be registered in, so that the majority of NHS referrals will be going through their own GP practice. They've got some ability then to track that. At UE, our students are registered with a whole range of GPs. So the number of direct referrals coming from the university are minimal, very, very small numbers. So the only way we ever get to find out is if a student comes back and tells us, or if an NHS service is able to share that information. So without the NHS routinely recording that someone is a student and what university they're from, it's almost impossible to track.
Right, some challenges there. So it's not all plain sailing. We are almost out of time. Unless anyone else has any other questions, I'd just like to say a really, really big thank you to Jamie and to Cara. We would really appreciate your feedback. I've just popped a link that will go directly to our feedback poll in the chat. If you'd like to click on that, it really is very quick. Just 3 questions about what you'd like to hear about, what you thought of the webinar today. So thank you again. Thank you for those people who've joined us. Really hope this is helpful in terms of just trying to think about what projects you might want to kind of set up, and there's lots of help available. So I will make this webinar available with all the links and any documents. Actually, Cara, on that note, are you able to make any of the reports that you've kind of completed so far available to us, that we can, perhaps link to those?
Yeah, absolutely. I can share those with you. Okay,
great. Brilliant. So thanks again. I hope that some of you or lots of you will be joining us at our conference next month. We have got a few sessions that I'll be focusing on mental health. One of our plenaries is looking at hope in November 2020, and Climate Psychology Alliance are joining us on that. There's also a lot of workshops just talking about, to give you the opportunity to hear about other projects that are happening, and hopefully you can feed into those with the Q&A and get more interactive in those. But hopefully we'll see you all soon. Thank you again to everybody, and I will see you hopefully very soon, and thanks again. Bye.